A 23-year-old woman with abdominal pain couldn't stop losing blood. This is what happened to her stomach. NM is a 23-year-old woman who was struggling with an illness she didn't understand. Over the past 3 months, she'd lost energy, her skin had become pale, and she felt an unusual pain growing in her abdomen. When her stomach started to swell and she felt too weak to even walk, her family took her to a local hospital. She had no idea that her body was hiding a silent threat that was slowly taking over her vital organs. And by the time doctors discovered what was wrong, it was already too late. NM was first admitted to her district hospital with severe abdominal pain and unexplained anemia, a condition where her blood lacked enough healthy red cells to carry oxygen. The doctors gave her blood transfusions to stabilize her, but the underlying cause of her symptoms remained unknown. At that time, her doctors noticed her abdomen was unusually distended. When they examined her, they discovered something that was easy to overlook but held critical clues to her illness: dark-colored stools. When stools are dark or tarry, it can be a sign of internal bleeding. This condition, known as melena, often meaning that blood is being lost in the upper gastrointestinal tract. Unlike when stools are bright red-colored, also known as hematochezia, usually a sign of internal bleeding in the lower gastrointestinal tract. But NM's doctors didn't have the resources at the local clinic to investigate further, so they treated her symptoms as best as they could. When she arrived at the university teaching hospital, doctors noticed she looked critically ill. She had a distended stomach, swollen legs, and her liver felt lumpy and enlarged. These were signs of severe internal issues, and the medical team suspected it could be related to her liver. They diagnosed her with non-cirrhotic hepatocellular carcinoma, a type of liver cancer unrelated to alcohol or liver disease, but they were unsure of the root cause. To gather more information, doctors ordered multiple tests. Her blood work showed an alarmingly high count of liver enzymes and alkaline phosphatase, a marker for bone or liver disease. Her liver was stiff and rigid, a finding confirmed by a transient elastography scan, a type of ultrasound that measures liver stiffness. CT scans revealed clusters of masses in her liver and even deposits in her lungs. At this point, NM was admitted and put on supportive treatments. But despite their efforts, her condition continued to worsen. On the 10th day, NM's blood pressure dropped dangerously low. Her doctors tried to stabilize her with IV fluids, oxygen therapy, and medication, but her body continued to shut down. At autopsy, NM's results revealed that she had gastric adenocarcinoma, a type of aggressive stomach cancer. But this wasn't a new cancer, it was a hidden cancer that had already spread to her liver, lungs, and pancreas. Her body had been fighting metastatic cancer, undetected, for an unknown period. Gastric cancer is one of the deadliest cancers worldwide, and it's especially difficult to detect early. In the beginning, it often has no symptoms. When symptoms do appear, they're usually nonspecific, like abdominal pain or mild anemia, and can be easily mistaken for more common conditions. In Zambia, many hospitals lacked the equipment to perform routine screenings, like endoscopies, which could have detected NM's cancer earlier. This meant her cancer went undiagnosed until it was too late. But why would a young person like NM get a type of cancer more common in people over 60? Researchers have found multiple possible factors, including genetics, diet, and environmental exposure. In many low-resource regions, diets often contain high levels of salt, which has been linked to an increased risk of gastric cancer. Exposure to biomass smoke, common in rural Zambia, though not commonly linked, may also contribute to stomach and esophageal cancers. If caught early, gastric cancer can sometimes be treated effectively. But without early detection, the disease can progress silently, leading to tragic outcomes like NM's. Thank you for watching, and please take care of your health. If you have unexplained symptoms, don't hesitate to seek a second opinion. Early detection could make all the difference.